How to assess head pain. There are a host of causes for head pain. By gathering information regarding the many sources, you can better identify how to address the issue and avoid inspiring a pain somewhere else. You will need attention to pain, questions, patience, and a doctor. Step 1. Determine the location of the pain, the temples, eyes, forehead, muscles in the face and neck, and so on. Step 2. Rate the intensity of the pain on a scale of 1 to 10. Determine whether the pain comes and goes or if that level of pain is continual. Though the intensity may indicate a migraine, there could be other factors like allergies or an infection. Step 3. Recall recent traumas or colds, earaches, and infections that may contribute to head pain. New medications may cause reactions involving severe pain. Food allergies can also create headaches. Step 4. Rule out possible causes by asking how light in the eyes affects the pain and what sort of things make it lessen or worsen. If the throbbing lasts for days, pulsates on one side, brings nausea, and is unaffected by over-the-counter drugs, a migraine is the likely culprit. Step 5. Evaluate factors like when pain occurs, such as when you wake up, right after eating, during stressful events, or while exercising. Step 6. Describe the pain as dull, sharp, pressured, disorienting, throbbing, or exploding. This information will be helpful to a doctor. Numbness, tingling, and weakness elsewhere might be related and could indicate something as severe as a stroke. Don't dismiss any signs. Step 7. Consult with a doctor who will collect information about past operations or sicknesses and finally make a diagnosis. With proper identification and care, you'll be on your way to treating your pain and feeling like new again. Did you know? According to one study, cigarettes may contribute to headaches, especially migraines.
How to use natural methods to cure a headache. Headaches are not only painful, they can affect your work performance and zap your energy. Instead of reaching for pain pills, try these natural cures. You will need a washcloth, a hot water bottle, a heating pad, a calming environment, and the ability to relax. Optional, peppermint oil. Step 1. Wet a washcloth in very cold water or place a damp washcloth in the freezer for 10 minutes. Place over your forehead. Use a few drops of peppermint oil on the cold cloth to speed relief. Step 2. Place a very warm washcloth or hot water bottle across your forehead. Place a heating pad across your neck and shoulders to relax tight muscles. Step 3. Rub the painful area of your head with gentle circular pressure for 7 to 15 seconds. Step 4. Lie down in a dark, quiet room and release tension by focusing on relaxing your back, neck, and shoulders. Step 5. Nap for an hour to sleep off the pain. Step 6. Eat regular meals and drink lots of water. Hunger and dehydration can cause headaches. Getting proper nutrition and fluids can put the odds back in your favor. Did you know? Tension, stress, sinus congestion, lack of sleep, caffeine withdrawal, and spinal problems can all cause headaches.
How to cure a headache with acupressure. Instead of reaching for a pain pill, massage away a headache using acupressure, the traditional Chinese curative technique of applying pressure to certain points of the body. You will need 2 hands. If you feel pain when using acupressure, stop immediately. Pregnant women should not use acupressure. Step 1. Using your index and middle fingers, apply pressure to the muscles by your temples, an area that holds a lot of tension. Keep up the pressure on this point and the following ones for 1 to 2 minutes. Pinpoint the correct spot by clenching and unclenching your jaw and feeling for throbbing. Step 2. Move on to your ears. Using your thumbs, massage the area underneath the large bones behind your ears using a circular motion. This corresponds to GB20, an acupressure point that can relieve many kinds of headaches. Step 3. Pinch the skin on the bridge of your nose between your eyebrows, an area known as the third eye point, and press it upward. Step 4. Finish up by squeezing the fleshy web of skin on the back of your hand between your thumb and index finger with the thumb and index finger of the other hand. This connects to the acupressure point LI4. Massaging it is particularly effective on sinus headaches. Do both hands. Step 5. Congratulate yourself for getting rid of your headache without the aid of modern medicine. Did you know? The average pharmacist offers advice to about 19 customers a week on over-the-counter headache remedies. How to get rid of an ice cream headache. When faced with the searing pain of brain freeze, use these quick tips to bring sweet relief. You will need a glass of warm water or milk. Step 1. Eat slowly. Wolfing down your favorite frozen treat will trigger the dreaded ice cream headache. Step 2. Pinch the bridge of your nose between your eyes and wait several seconds. The pain should subside. You don't need to press hard to bring relief, just apply firm pressure. Step 3. Press your tongue to the roof of your mouth and, again, wait several seconds for relief. Step 4. Sip warm water or milk for one of the fastest and easiest ways to relieve an ice cream headache. Step 5. Wait. The pain is not permanent and will eventually pass. Follow these simple tips and you can have your ice cream and enjoy it too. Did you know people who suffer from migraines are more likely to experience an ice cream headache?
Got a headache? Quick tips. Before popping a pill, dab peppermint oil on your forehead and temples. It relieves some types of headaches. Nifty!